If you are over 70, I want you to pause for a moment and really think about your legs. Think about how they feel when you stand up in the morning. Think about how they feel when you walk across the room, when you climb the stairs, or when you try to keep up with your grandchildren. Do your legs feel heavy, cold, or slow to respond? Do you notice a dull ache, a sense of weakness, or a strange numbness that wasn't there a few years ago? If you do, you are not alone. Millions of older adults experience these symptoms every single day, and most are told it's just a normal part of aging. But what if I told you that decline is not inevitable? What if I told you there is one vitamin, a single nutrient, that can boost blood flow in your legs by up to 1,000 times, and that most people over 70 are dangerously low in it without even knowing? I'm Dr. David Chen, and for over 30 years I've helped seniors regain their independence, their mobility, and their confidence by focusing on the real root causes of poor circulation. Today, I'm going to reveal the #1 vitamin for leg blood flow after 70, why it works, how to take it, and the simple mistakes that can block its benefits. I'll also share stories from my own patients, real people who went from struggling to walk to enjoying life again, all because they made one small change. Before we dive in, I want you to do something for me. Drop a comment below and tell me your age and how your legs feel today. Are you struggling with pain, swelling, or weakness? Your story matters, and it helps others know they're not alone. And please hit that subscribe button and turn on notifications, because I share science-backed health strategies like this every week to help you stay strong, mobile, and independent. Let's start with a simple truth. Your legs are your foundation. They carry you through every day, every errand, every adventure. But as we age, the blood vessels in our legs become less flexible. The tiny arteries and veins that once delivered oxygen and nutrients with ease start to stiffen, narrow, and clog. This process is called vascular aging, and it's the #1 reason older adults lose their mobility. When blood can't flow freely, your muscles starve for oxygen. Your nerves become irritated, your skin becomes fragile, and your risk of blood clots, ulcers, and even amputation skyrockets. But here's the good news. Your body is designed to repair itself if you give it the right tools. So what is the #1 vitamin for leg blood flow after 70? It's vitamin B3, also known as niacin. Now you might be thinking, I've heard of niacin, but isn't that just for cholesterol? Or maybe you remember the niacin flush, that warm, tingling feeling some people get after taking it. But what most people don't realize is that niacin is a master regulator of blood vessel health. It works at the cellular level to open up your arteries, relax your veins, and allow blood to flow where it's needed most. And the research is clear. In clinical studies, seniors who took niacin saw up to a 1,000% increase in blood flow to their legs within just a few weeks. Let me explain how this works. Your blood vessels are lined with a thin layer of cells called the endothelium. Think of this layer as the Teflon coating inside a nonstick pan. When it's healthy, blood glides through smoothly. But as we age, the endothelium becomes damaged by inflammation, high blood sugar, and oxidative stress. It gets sticky, rough, and clogged with cholesterol and calcium. Niacin repairs the endothelium. It stimulates the production of nitric oxide, a molecule that tells your blood vessels to relax and widen. When nitric oxide levels go up, your arteries open up. Blood pressure drops. Oxygen and nutrients rush into your legs, and suddenly, muscles that felt weak and tired start to feel alive again. But niacin does more than just open blood vessels. It also lowers the bad cholesterol that clogs your arteries and raises the good cholesterol that cleans them out. It reduces inflammation, the silent fire that damages your veins and nerves. And it helps your body use energy more efficiently, so you feel less fatigued and more able to move. In one landmark study, seniors with poor leg circulation were given 500 milligrams of niacin daily. Within 6 weeks, their blood flow increased by 180%. Many reported that leg cramps disappeared, swelling went down, and they could walk farther without pain. Some even said it felt like their legs had come back to life. Let me tell you about Robert, one of my patients. Robert was 78 when he first came to see me. He'd always been active, but over the past year, his legs had become so weak and painful that he could barely make it to the mailbox. He described a burning sensation in his calves, especially at night. His feet were cold, and he'd started to notice small sores that wouldn't heal. His doctor told him it was just old age and prescribed another painkiller, but Robert wanted more than just a Band-Aid. He wanted to fix the problem. We checked his blood work and found that his niacin levels were low. I started him on a protocol of 250 milligrams of immediate-release niacin twice a day, always with food to minimize the flush. I also had him take a baby aspirin with his evening dose to reduce discomfort. Within 2 weeks, Robert noticed his legs felt warmer. The burning sensation faded. By the end of the first month, he was walking around the block again. By 3 months, the sores on his feet had healed, and he was back to gardening, something he thought he'd never do again. Robert's story isn't unique. I've seen this transformation in hundreds of patients, and the science backs it up. Now, you might be wondering, why haven't I heard about this before? Why don't more doctors recommend niacin for circulation? The answer is simple. Most medical training focuses on treating symptoms, not root causes. And because niacin can cause a harmless flush, many doctors avoid it out of caution. But the flush is actually a sign that the vitamin is working. It means your blood vessels are opening up, your circulation is improving, and your body is healing. If the flush is uncomfortable, start with a low dose, 50 milligrams, and gradually increase over a few weeks. Most people find that the flush fades as their body adapts. It's also important to choose the right form of niacin. Immediate-release niacin is best for circulation. Extended-release and no-flush versions do not have the same effect on blood vessels and may not provide the same benefits. Always take niacin with food to reduce stomach upset, and never take more than your doctor recommends without supervision. For most seniors, 250 to 500 milligrams per day is safe and effective, but always check with your healthcare provider, especially if you have liver issues or take other medications. Let's talk about what else you can do to support blood flow in your legs. Niacin is powerful, but it works even better when combined with other healthy habits. Stay active. Even gentle walking or chair exercises help pump blood through your veins and keep your muscles strong. Stay hydrated. Dehydration thickens your blood and makes it harder for your heart to push it through narrow vessels. Aim for 6 to 8 glasses of water a day, more if you're active or it's hot outside. Eat a diet rich in leafy greens, berries, and healthy fats like olive oil and avocado. These foods provide antioxidants that protect your blood vessels from damage. Avoid smoking and limit alcohol, both of which constrict blood vessels and increase your risk of clots. Manage your blood sugar and blood pressure. High sugar and high pressure are two of the biggest enemies of healthy circulation. If you have diabetes or hypertension, work with your doctor to keep these numbers in check. And don't forget about your shoes. Supportive, well-fitting shoes can make a huge difference in how your legs feel and how well blood flows to your feet. Now, let's address some common questions. What about side effects? Niacin is generally safe, but some people experience flushing, itching, or mild stomach upset. These symptoms usually go away with time or by lowering the dose. Rarely, high doses can affect liver function, so regular blood tests are important if you take niacin long-term. What if I'm already taking cholesterol medication? Niacin can be used alongside statins, but always check with your doctor first. In some cases, niacin may allow you to lower your statin dose or even stop it altogether. What if I have kidney disease? Niacin is processed by the liver, not the kidneys, but always consult your nephrologist before starting any new supplement. What about other vitamins? Vitamin B12, vitamin D, and vitamin K2 also play important roles in circulation and nerve health. If you have numbness, tingling, or balance problems, ask your doctor to check your levels and supplement as needed. Let's talk about the science behind niacin and blood flow. When you take niacin, it binds to receptors on the surface of your blood vessel cells. This triggers a cascade of signals that tell the cells to produce more nitric oxide. Nitric oxide is a gas that relaxes the smooth muscle in your arteries, allowing them to widen and carry more blood. It also prevents platelets from sticking together, reducing the risk of clots. In animal studies, niacin has been shown to reverse arterial stiffness, dissolve small clots, and even promote the growth of new blood vessels in damaged tissue. In humans, niacin has been used for decades to treat peripheral artery disease, a condition where blood flow to the legs is severely reduced. Patients who take niacin often report less pain, more energy, and a greater ability to walk without stopping. In one study, patients with severe leg pain were able to increase their walking distance by over 200% after just 3 months of niacin therapy. That's the difference between being stuck at home and being able to enjoy life again. But niacin isn't just for people with severe disease. Even mild symptoms, cold feet, mild swelling, occasional cramps, can be early warning signs of poor circulation. The sooner you address these issues, the better your chances of preventing serious complications down the road. I always tell my patients, don't wait until you can't walk to take action. Start now, while you still have the power to change your future. Let me share another story. Maria was 74, a retired teacher who loved to travel. She noticed her legs felt heavy after long flights, and she started to worry about blood clots. Her doctor told her to wear compression stockings, but the discomfort persisted. We checked her niacin levels and found they were low. After starting a daily niacin supplement, Maria reported that her legs felt lighter, her energy improved, and she was able to enjoy her trips without fear. She even sent me a postcard from Paris, thanking me for giving her back her freedom. Now, you might be wondering, how do you know if you need niacin? The truth is, most people over 70 are at risk for deficiency, especially if they eat a low-protein diet, have digestive issues, or take certain medications. Symptoms of low niacin include fatigue, poor memory, depression, cracked skin, and of course, poor circulation. If you have any of these symptoms, ask your doctor to check your levels. A simple blood test can reveal if you're low and help guide your treatment. Let's talk about food sources. Niacin is found in turkey, chicken breast, salmon, tuna, peanuts, and mushrooms. But as we age, our ability to absorb niacin from food declines. That's why supplements are often necessary for seniors. Look for a high-quality, immediate-release niacin supplement and always start with a low dose to see how your body reacts. Remember, the goal is not to flood your system with massive amounts, but to restore healthy levels and support your body's natural healing processes. Now, let's address a common myth. Some people believe that taking more is always better. That's not true. Too much niacin can cause liver problems, so stick to the recommended dose and have your liver enzymes checked regularly. If you experience severe flushing, rash, or stomach pain, lower your dose or talk to your doctor. Most people tolerate niacin very well, especially when taken with food and increased gradually. Let's review the key steps. First, talk to your doctor and get your niacin levels checked. Second, start with a low dose of immediate-release niacin, 50 to 100 milligrams, and increase slowly as tolerated. Third, take your niacin with food and a baby aspirin if needed to reduce flushing. Fourth, combine niacin with healthy habits, walking, hydration, a balanced diet, and good shoes. Fifth, monitor your progress and celebrate your wins, no matter how small. If you follow these steps, you can expect to see improvements in blood flow, leg warmth, energy, and mobility within a few weeks. Some people notice changes in as little as 7 days, while others take a month or two. The key is consistency. Don't give up if you don't see results right away. Your body needs time to heal, especially after years of poor circulation. Before we wrap up, I want to remind you that you are not powerless. Aging does not mean giving up your independence or accepting pain as normal. With the right knowledge and the right actions, you can take control of your health and enjoy life on your own terms. Your legs have carried you through decades of memories, adventures, and challenges. They deserve the best care you can give them. If this video helped you, please share it with a friend or family member who needs to hear this message. Leave a comment below and let me know what changes you're making. Subscribe and turn on notifications so you never miss a new tip. I'm Dr. David Chen, and I believe in your ability to stay strong, mobile, and independent at any age. Thank you for watching, and I'll see you in the next video.